welcome to the Hospitals of Providence East Campus. My name is Ellen Rodriguez. I am the Trauma Program Manager here at East Campus. Today we are here at the Hospitals of Providence Outpatient Rehab Services, and I am here with Ms. Susanna and Emma, occupational therapist and physical therapist. Before we get started, I'd like to go ahead and just disclose that we are all fully vaccinated, Susanna, Emma, and myself, and currently following the CDC guidelines. With that being said, Susanna, do you want to go ahead and introduce yourself?
Yes, so my name's Susanna Gomez. I'm one of the physical therapists here. I've been a physical therapist for 9 years. I've been with Providence for 6. One of the populations that we work with a lot is the older adult population.
Perfect. Thank you, Susanna. Emma, would you like to go ahead and just tell us a little bit about yourself?
Hello, my name is Emma Mejia. I'm an occupational therapist here at the Hospitals of Providence. I've been an occupational therapist for 3 years, and those 3 years I've worked here at the Hospitals of Providence. I work with the adult population in a variety of settings.
Thank you, Emma. How common are falls in the older population?
Falls are very common in the older population, 65 years and older. At least 1 in every 4 adults has reported a fall. The fall risk increases as the age advances. Adults with an age of 85 years and older are at a higher risk of falling. It also increases if they are a female.
So being a female and as you get older does increase
Increases.
your risk of falls. So that could be anybody like your grandmother or anybody's parents, things like that. So it's really
Exactly.
important that we start talking about this. So aside from my age, what else is going to put me at risk for falls?
There are other factors that can contribute to a fall, included limited vision, limited control of urinary and bowel control, weakness and pain to the body, specifically if the weakness is to the lower back and legs, limited sensation and tingling to the feet, which can contribute to tripping and falling, dizziness, depression, as well as any other home setup that can contribute to a fall, including uneven surfaces, steps, rugs, and other things that are on the floor that can contribute to a person tripping and falling.
Yeah, and that's really important because I know a lot of people want a carpet because it allows grip, but
Exactly.
if it's hanging up on the side, then yeah, that can definitely be a risk for falling. So where do most of the falls occur in the household?
Falls can happen in everyday living. People can be doing the tasks that they normally do, such as getting up from bed, transferring to a toilet, transferring to a shower, specifically if the shower is wet or there's uneven surfaces, as well as reaching for something. Those things that we do in a regular day can contribute to a fall.
And is there, sorry, go ahead.
Yes, and a lot of people think that a fall is going to happen outside of their home, but research shows that most falls happen in the house.
Okay, inside the house. And that's what I was going to ask. When do they usually occur? Have you guys seen that people usually report it more at night than they do the day, or what do you guys see most commonly?
Sometimes, like we mentioned with the poor visibility, patients that are, or people that are transferring from the bed to the toilet tend to have poor visibility during the night, and they don't see where they're stepping, they don't see where they're going, which can lead to a fall.
So maybe even some prevention things are putting a nightlight or something like that. That would be helpful too. Perfect. So what are some consequences of a fall?
One of the biggest consequences from a fall would be a fracture, broken bone, head injury. Falls is the leading cause of non-fatal and fatal accidents in the older adult population.
Okay. And I know one of the things that we usually see in trauma in our older population is hip fractures.
Yes.
So being that is so common from our older population having falls, how long is the recovery for a hip fracture?
Recovery for a hip fracture could be from 6 months to a year, and also even up to 2 years, depending if the patient suffers from other medical conditions such as osteoporosis, diabetes, if they were already hurting from another joint, or if they were already experiencing weaknesses. It could take up to 2 years to recover.
That's a long time. So in order to keep everybody safe, what are or how can we make our home safe?
We can make our home safe by making modifications at home, getting rid of throw rugs, putting grab bars in the showers, in the restroom, having a raised toilet seat, a shower chair, also putting night lights like you mentioned in the hallways, in the rooms for when the person gets up in the middle of the night and goes to the restroom. And having the day-to-day things that they use at arm's reach, that they don't have to use a stool to reach for the items. And also making sure that the walkway is clear, it's not too narrow, it's not too crowded, things like that.
Those are very good tips. Very nice. What else can we do to decrease our risk of falls?
If you feel that you are someone that's at risk of falling, see your doctor and request for a physical therapy referral, because once you're here with a physical therapist, they'll evaluate you and determine if you are at risk for a fall, and they'll tailor your program depending on what modifications they suggest you need to do at home, or if you need to work on balance, strengthening to decrease the risk of falling.
So it's a two-parter. It's making sure your home is a safe environment, such as
Yes.
the tips you just gave, and then also yourself, making sure that your gait is right, that your muscles are stronger and things like that.
Yes, your balance, everything like that.
Perfect. So what do we do if we have a fall?
If we have a fall, definitely go see your doctor. Sometimes a fall might not cause an injury and it will make you not want to see your doctor. But I advise that you do, one, to make sure that you don't have a fracture or an injury or a head injury that's bleeding internally. Also, to get that physical therapy referral, because once you're with the physical therapist, they'll determine what the cause of a fall was. Was it your medications? Is it your balance, strength? Is it something that you need to do in your house to decrease your risk of falls? Because a lot of the times when a person falls, they become fearful of falling again, and so they limit their activity, which makes them weaker, which puts them at a higher risk of fall. So if you experience a fall, visit your doctor, let them know, and request for physical therapy referral.
And like you just mentioned, if they have a fall, they're scared to have another one, so I'm sure that's going to put them at risk. Statistically, how much more likely are you to have a fall after you've had one?
It doubles your risk of falling again. So if you fall once, it's very likely that you'll fall again. And falls can really have an impact on your life. It can change your quality of life from being independent to now requiring a walker or requiring assistance at home, maybe not being able to live on your own anymore. And so prevention is key to decrease the risk of falls.
Very nice. So to just summarize and wrap everything up, we know that it's a conjunction with multidisciplinary, right? Mm-hmm. So working with physical therapists, working with your physician as well, and then of course things that everybody can do at home to prevent the risk of falling, and then to make everything stronger so that you prevent the risk of falling again if you have already suffered a fall. So thank you ladies very much for providing your expertise. Thank you everybody for joining us today. Thank you Susanna and Emma and all the services that you all provide. If you would like to learn more about the services these ladies provide and what the Hospitals of Providence East Campus provides, we invite you to visit our website at thehospitalsofprovidence.com, and thank you all again for joining us.
Thank you.
Thank you.